Thank you. So as was stated before, this evening we're going to be talking about change and why change is so hard. I know each community member and each team member here this evening has struggled with wanting to change something about their lives. Maybe you wanted to lose weight, or maybe exercise more, or maybe change your diet. And it's very, very difficult to do. So tonight we're going to be, Dr. Peterson is going to be sharing with us some reasons why it is hard for some of us to change. So Dr. Peterson, why is change hard, particularly when people are misusing or abusing substances?
That's a good question. I think one of the questions, what you're really asking me is why is it hard to make behavior changes and to change habits from substances that you're using, particularly maybe opioid addiction or something like that. Change is hard because there are a number of factors why change is hard. And I've listed here about 5 different categories, and we'll talk about each one briefly. The first one is the environment. We live in a toxic health and wellness world environment. And when it comes to our health, fitness and wellness, we often adapt negative or toxic behaviors from behavioral influences from family, friends, associates, peers, homes, schools, workplaces, media, the general culture, our community, and the environment we live in. Another reason why change is difficult is because of biology. We are all individuals with a similar but particular genetic makeup. In other words, our makeup is specific to ourselves. We are unique beings. Thus, we are affected differently by our environment. Culture, things, actions, and behaviors we adopt in the environment. In his earliest childhood, we start to become habituated to our environment and begin adopting behaviors and developing habits that we desire to emulate without even realizing it. The next one is behavior. Our behaviors are influenced and developed from many factors, including our family life, our culture, our religion, personal values, our media, work, education, and knowledge, and once again, the environment we live in. Another one is habits. Habits, whether they're good or bad, are developed through intentional or mindful practices and repetition, often from cues or triggers in our daily environment. Regular practice of behaviors results in habits which become ingrained or adapted into the brain. And then, of course, motivation is the last one I'm going to look at. Our behaviors are usually based on our sets of values. Researchers believe that a person's values are the strongest motivators in life for development of behavior and habits throughout the person's life. And usually those motivations for values come from the way we were raised in our families, our religious beliefs, of religious thinking, also the influence of our culture and the surrounding environment.
Okay, so it sounds like change is kind of difficult, is a little complicated, and this is why it's not so easy, because there's a lot of factors.
You're absolutely right.
Okay, so then the next question would be, why is change important especially when you're recovering from an addiction? Why is it so important?
Why is change so important in recovering from an addiction? Well, our brain develops most of our habits based on rewards. Humans value instant rewards more than long-term rewards, okay? And part of our brain called the corpus striatum plays a role in habit formation. The corpus striatum in the brain is part of the basal ganglia, largest nucleus. And if you can remember from previous lectures we gave, the basal ganglia in the brain can be equivalent to what we call the gear shift in our automobile or vehicles. And so what happens is that it becomes activated by events that are rewarding, exciting, unexpected, and intense. The corpus striatum cues from the environment associated with these events, and it plays a key role in behavior and habit formation. The striatum memorizes pleasurable and rewarding events, such as opioid use, which results from reward released by dopamine. Dopamine, of course, is a neurotransmitter developed in the brain, and it's associated with cognition, learning, behavior, motivation, and it helps the person seek repeated reward opportunities as often as possible. And this is exactly what happens in a person once they become addicted to opioids or some other type of drug. They want it repeated as often as possible. This behavior becomes ingrained in the brain's striatum for willful change. This is one way we can internalize and validate negative social practices that are from our community and environment with little thought to how they might cause us long-term harm or damage to our health. Behavior followed by repeated pairings with a reward becomes a conditioned response, and it's hardwired in the brain. Pleasurable and rewarding behavior is triggered by a familiar environment or cues or triggers, which the brain automatically responds to by performing the habit or the behavior.
Okay. So when you are addicted to a substance, how do we know when we are ready for change? Does a person really maybe have to be on their last leg, hit rock bottom, or how do we know when we're ready?
That's a very good question. One of the most important things about change is it's important to understand that there will be some barriers to difficult, and it might not come very easily. Most times we do not like to spend a lot of time on things that don't come fairly easy for us. A brief listing of some barriers that might be encountered includes an unsettled or lack of core values, or doing the same thing in the same context almost every day without thinking about it. And the core values are extremely important. Your moral values, what is right, what is wrong, what is good for health, all these things are very important in establishing a person's core values. And it's the core values that each of us live by day that determines our behavior and the habits we actually develop. Another thing is procrastination, or the risk of complacency. Sometimes when we like or enjoy doing something and we find it to be very pleasurable, we are hesitant about giving it up. We're very complacent about that. We really don't want to give it up because we really enjoy it. Another barrier could be preconditioned cultural beliefs. Sometimes our culture plays such a strong influence on our thoughts and our behavior and even in the formation of our values that, you know, in the current culture we live in now, using illicit drugs or even illegal drugs that might cause harm over a long period of time if they're abused does not seem to be a pose a problem for some people. Another one is gratification. Intentionally or not, you spent the past months or years creating new or often unhealthy habits, like for instance, opioid addiction. And that particularly is so gratifying, it's so fulfilling to the person, and especially initially when they get started, that they really don't want to give it up. Indifference and helplessness is another reason, another barrier that might cause us to have difficulty in actually changing habits or changing behaviors. Indifference and helplessness. Sometimes people feel like they just cannot do it. I can't do it. I don't have the strength. I don't have the self-control. I don't have the resolve to actually do this. In other words, the self-esteem is kind of low, and they feel like that it's almost impossible for them to overcome the difficulty that they're having with the particular problem. Another one is rationalization. Oftentimes we rationalize that I can always stop doing something that even if it's negative, I can always stop whenever I want to do. And I'll give you a case, an example of this. We'll talk about this a little later on. And that is, I had a patient once who in previous years, I've done a number of stop smoking sessions. And remember talking to an individual who said to me, "Oh, I can kick the habit anytime I want to. I enjoy it right now, but I can kick it. I can stop smoking anytime I want to." And after a period of time, they finally began realizing it was not as easy to kick the habit as they really thought. It's easier to actually start forming negative habits than it is to stop and change that behavior and the habit. Another thing is illusions of invincibility. Oh, it'll never happen to me. Nope. And that's the same person that I'm just talking to you about, a patient, actually said that to me. I can stop. It won't do anything to me. I can overcome it. Another one is avoiding over planning. The brain actually requires up to about 3 months of daily repetition to develop the neural pathway that automates or ingrains a behavior or habit in our brain. But we have to realize that excessive stress or distress often triggers old habits. And for instance, an example is an argument with a roommate or a friend or family member can lead to an unhealthy action. So you must prepare beforehand for an adequate response in such situations. And oftentimes, when we actually have any of the previous barriers we've mentioned, it's not as easy to make that preparation as we might think. If a mistake is made and you do not adequately respond to the specific situation, attribute it up to experience, as as a learning tool. The next time, come back with a proper response. But the truth too, though, is that most people go through a change process before they are ready for a change in
Mm.
behaviors or habits. And tonight we're going to talk about a series of changes that people have to go through before they actually become ready to make a change, a behavior change. And it goes through by a series of changes that helps the person's readiness to change that behavior and habits.
Yes, thank you. So one of the things I think that is important is for our community members and their families, friends, coworkers to realize that really, unless you're ready to make a change, it really is not going to happen. And as the next slide will show, in healthcare, there are several models or theories that people use to try to help their patients or clients get ready for change and to make those changes. So these are just a few of the models, the stages of change model, and that's the one we're going to talk about tonight, the health belief model, and also the theory of planned behavior. So the next slide will show an illustration will show the steps of the stages of change. And one of the things that I like about this model is that in each stage, you can hang out with the person. As long as you know which stage they're in, you can work with them, talk with them, be patient, and you can help them as you collaborate with them to help them make this the next stage. So, for instance, in the pre-contemplation stage, you can just, if you know they're not really ready for a change, you can work with them in that stage. And as Dr. Peterson he will illustrate and talk more about each stage uh, with the next slide. Well, and this is a sixth stage, sorry, the relapse, and that's a very important stage as well.
The stages we want to talk about, there are 6 stages in this particular plan we're talking about for behavior change. The first step is what we call a pre-contemplation stage. And just as the previous slide, as this slide just said, oftentimes the person may not even be aware that they have a problem until it started causing difficulty in their lives or on the lives of the associates or family members. Then they begin realizing, and sometimes someone else has to point out to them that they actually have a problem. So they're not ready or unwilling to change behavior. They're not even thinking about making changes. Everything seems to be okay. So everything's fine. Uh, the next stage is what we call a contemplation stage. That's a point in which the individual starts to give serious consideration and start thinking about the need for change in behaviors and habits within the next 6 months, because their behavior is not only affecting themselves, but it's also affecting others in their surrounding environment, family members, associates, colleagues. So they realize that they actually really need to make a change. The next stage, the third stage, is the preparation stage. That's when the individual is preparing to change within the next 1 to 3 months. They know that they seriously have to make changes, so they start planning and making preparation to make changes that will be moving from a negative or difficult behavior or an unacceptable behavior or undesirable behavior to a more positive behavior and habit. The fourth stage is what we call the action stage. Now, in the action stage, they actively change a negative behavior or adopt a new healthy behavior or habit. And that's not an easy thing to do. As we just mentioned, it actually takes a period of actually several weeks to months to make a change from an old habit to a new habit. But they actually may act stage, maintaining behavioral change for up to 5 years. And that is the stage where the person has actually been able to continue making the positive changes, but they may have an occasion what we call a relapse. Relapse happens, folks. It happens. And most people will fall off the wagon. In substance abuse or substance misuse, the relapse rate falls between 40 and 60%. And whether 6 months or 5 years, reverting back on former behavior habits is normal. Now, what I'd like to do at this point is just to give you a little brief example of what had happened to me in the past when I worked with individuals who in stop smoking programs. So I had this one particular patient. It was a young lady who had been smoking for a number of years. I think she said actually started smoking in her teen years. And at the point at which I met her, she was actually in her fifth to sixth decade. She was in the when I talked to her, she was in the pre-contemplation stage. She had no idea that smoking was causing a problem. And I tell you what made her begin to realize she needed to start doing some serious thinking about it in the pre-contemplation stage. She went in to see her personal physician, and the physician said to her, I think you're beginning to develop some problems in your lungs, and we need to take some x-rays and do some other respiratory checks. So they did some x-rays on whatever, and they found that she was in the early stage of developing lung cancer, okay? One of the things many people may not know is that women, females, seem to be a little bit more sensitive to developing lung cancer than are males. It does not mean the males don't develop it. They both can develop lung cancer. But women, females tend to be a little bit more sensitive to developing lung cancer at an earlier, faster rate than are men. So in the contemplation stage, she started thinking very seriously about making some changes because she knows she needed to make behavior change, not just because it was affecting others, but because it was really affecting her own life and her future. So she's in the preparation stage, she started making some changes. She decided to come to the stop smoking program we were having. It's interesting because I met her indirectly. I have a person I think I'm recommending that you talk to about making changes in the lifestyle. And just as DB said earlier, you can't make a person change unless the person can't force them to change. She had to come to that decision where she realized she needed to make changes. So she started making preparations. She came to the Stop Smoking program. She actually took action. And she went through the program. In fact, she went through the program more than once because it took her several times. And after that happened, she began in the maintenance stage, behavior did change. And she did tell me, she confessed one day, we were talking, I met her, and she said, I have fallen off the wagon a few times. And I said to her, that's a very normal thing. It happens. And no matter how long, because once you get a habit like this ingrained in the brain, it's very difficult for you to actually overcome it. So she did fall off the wagon, but she was able to continue on. And sometimes we may revert back to former behavior habits. That's a normal thing. And I had to explain that to her. What do we do when we relapse, though? It's crucial to staying within the model. Stay on the plan that you laid out. What triggered the relapse? What are the barriers? Ask yourself these questions. Keep your vision in mind. Start over again. Get up. Get back on the wagon and move forward to your goals. And then, of course, there's the termination stage. Eliminating an undesirable behavior or maintaining a positive behavior for more than 5 years is what we see when we say a person has actually terminated a negative behavior. Experiences that bring about strong emotions that impact desire to change can actually cause the person to remember what they've gone through.
Thank you so much, Dr. Peterson. And once again, I think that once we are aware of the process, we can really help our family members and friends and be patient with them, support them, and just be there like their cheerleader, their coach. As long as we know, we don't get frustrated. I think that's the other thing. As long as we know that there are different stages and it's not really linear, I mean, they can circle around, circle back, but as long as we know that, I think it can be very helpful for us as we try to help each other. And so this slide is just a representation of what Dr. Peterson said earlier about what happens in each stage, each stage, and the time frames.
I'd like to give you a little example, some practical steps to succeed in change. We use an acronym called SMART. SMART. S is for specific, M is for measurable, A is for achievable, R is for relevant, and T is for time bound. The first step to successful behavior is recognizing you have a problem. As I said to you before, this lady she enjoyed smoking. In fact, I think she started smoking in her teens, and she really enjoyed smoking. But when she recognized that she had a problem, she realized she needed to act, and she needed to act quickly. So first thing is recognizing you have a problem. The second thing is you have to have a specific individualized plan just for you. Know and understand the cues, the barriers, and triggers that will be present to hinder adopting behavioral change. And in making this plan, make sure you have a good support system. The support system is crucial. Family members, friends, and you want to make sure that you're associating with those individuals include individuals in your plan that actually who will be encouraged. Oh, you're almost guaranteed to fall off the wagon at some point or time during that process. But include as many people, get as many people or individuals with strong social support as you can. The next thing is a measurable plan. Get a plan or design a plan or get someone to help you design a plan that works for you, specifically for you, because you're an individual with measurable steps included. Now, those steps must be something that allows you to know that you're making progress towards your problem, toward changing a negative behavior into a positive behavior. The next step after that is the A, achievable. Achievable plan is something that's realistic. Can I do this? Do I have the self-efficacy? Can I do this? Self-efficacy says that I believe that I can get this done. I have the ability to do this. I have the capacity, I have the support and friendship and relationships that will support me along the way as I go through this process, and it is achievable process. It's doable. I can do this. The next thing is the relevant plan to address the particular opioid or substance misuse problem that you're dealing with, and that will assist you in making the desired behavior changes. Will it motivate you to stop practicing negative behavior and habits? That is very, very important. So that's if it's relevant, it will help you do those things. The last part is the T, time bound. Time bound plans provide for and allows adequate time for change in behavior and habits. Remember, this thing didn't happen overnight, and it's not going to change overnight. It might take you some time. In fact, it's more than likely it will take you years. Remember that the brain requires up to a minimum, on average, of about 3 months of daily repetition, on average, to develop the neural pathways in the corpus striatum circuitry to automate a behavior and habit. But you got to remember, it might take longer to eradicate an undesired behavior or habit. And what you have to do is be patient with yourself and associate with individuals and partners that would actually help you along that pathway and will be so patient with you that will help you to become accountable for what you're doing. And they will call you on the carpet when you're not doing what you're supposed to do, but they'll do it in a loving manner. Those are things that are extremely important. And that's what the SMART goals all about.
Okay, thank you. So our next slide is going to summarize. Dr. Peterson, if you would just summarize what we've talked about.
Dealing with a habit or a practice that is undesirable. And when we understand what factors are involved and how these factors affect the change process, change is possible. It is possible. It's doable. We must always keep it in mind. And we must think positively about these particular things and set up a plan of action, a time-bound plan, a relevant plan, and a plan that would help us achieve our goals. Go from denial to relapse. First, many people who have a problem like this, or any problem, and I think every last one of us at one point in our life have experienced, have a habit or practice that we won't like to get rid of. We this evening we used the example of tobacco, but it could be almost any problem. Maybe you're an individual who don't like to exercise or don't drink sufficient amounts of water. And I remember one of my patients used to came in one day, and she said to us she was having some challenges with her elimination. So we asked her, how much water do you drink? She said, well, I drink lots of water. Are you sure? She said, no, yeah, I drink lots of water. So we asked her, do you think you drink enough water? Oh, yeah, I drink plenty of water. She was in denial. And finally, we said, tell you what you do. You go and we want you to take a daily record and another week or two, come back and tell us average how much water you're drinking. She was drinking on average about 2 glasses of water a day. Now, that's certainly insufficient for a person who may be having challenges with their elimination. So, but there are stages or steps that can help clarify when a person is ready to begin the journey. She was ready to make some changes at that point. Setting realistic and smart goals helps guide, rework, define, or just the work of change. But don't ever, ever give up, because you can do it.
I have a question.
Yes.
Doctor, there are advertised on TV recovery centers. I see a commercial, Recovery Centers of America, very often. When people go to a recovery center, what happens when they go back home into their normal environment?
You know, that's a good question. And that perhaps is one of the biggest challenges of a situation like that. It all depends on several factors. The first of it all, it depends on whether or not that person has gone to a recovery center and what kind of structure they use in that recovery center. Sometimes the person is left to complete a lot of the program on. In other situations, there are times when they have a counselor or a person who actually coaches them and goes through the entire program with them, telling them what they have to do. But one of the key factors that's involved in the whole thing is that the person must be integrally involved in the whole process from beginning to end. They must have decided that they really want to make that change. They're willing to go through the change process of change and accept the program as given to them. But they also tell them, and once you leave here, you have to have a strong support system. The strong support system, believe it or not, a strong support system is just as important as going through the process itself. Because oftentimes these kinds of behaviors and habits are so deeply ingrained that if you don't have someone to encourage you, assist you, it's very easy to give up. So it varies from one place to another. Then the other two depends on the cost of the program.
Thank you very much.
Good insurance, excellent insurance. And you have to look at the small print in insurance to make sure it covers opioid or drug addiction or substance abuse addiction problems. Because if it doesn't, and you go into one of these facilities, you may have to spend a lot of money.
Thank you very much.